we're live at the FHLIP conference, and we have a very special guest with us today. So please, I'm going to hand it over to you so you can introduce yourself and tell us where you're from and a little bit about yourself in general.
Hi, my name is Joseph Ferenbok, and I'm with the Health Innovation Hub. That is one of 12 campus-linked accelerators at the U of T. I'm also prof here in the Faculty of Medicine, Timerty Faculty of Medicine, I should be specific. And I work in the space of translational research, thinking about how do we get new ideas, new knowledge out to people and make an impact. What H2I does specifically is we help mentor people and enable people to take commercializable ideas forward and navigate the somewhat arcane, complex health ecosystem that we have both locally, and we also look at how do we have impact internationally. So that's sort of a little bit about who I am and what I do.
No, that's incredible. And so for the first time at the FHLIP conference, we have a startup zone, and your organization, your team is a big part of that. So share a little bit about what made you agree to kind of participate and help FHLIP kind of, build up the startup zone. And
Mhm.
yeah, I'll just hand it over to you to share a bit about that.
Well, H2I, the Health Innovation Hub, I'm actually one of the original co-founders with Paul Santerre. We started this about 12 years ago because we realized our students didn't really have sort of structured support that's co-curricular, that's outside the classroom, to be able to understand how to take knowledge and how to work within the healthcare system. So H2I is really that mechanism and has evolved to become that mechanism within the Vice Dean's Office of Research in the Faculty of Medicine to offer to anyone. So we don't just deal with uh, our students or medicine faculty. We actually are believe there's no wrong door across all three campuses and much further. Um, People come to us for mentorship, for access to programming, for access to other units or other partners that we have in the community when they are either just considering entrepreneurship, that's just this tingle in their brain and they think, oh, I might try this. Or more often when they are starting something and they may not be incorporated, they may not have any paid employees, they may not be paying themselves, but they have a good idea and they believe in it. And so we help advise them and mentor them. We don't take any equity. We have no fees. The main responsibility is that we want our ventures, once they are accepted, to have a 1 hour, one session every quarter, every 3 months with their advisor to stay relevant.
No, that's incredible because I think like even on the Power Speaks Healthcare Talks podcast, we've had some vendors and they say that's one piece that they're not sure about when giving up equity, going into the venture capital, all of that. So sharing that there are services where they're able to navigate that without that piece, I think. And at some point, depending on what vendor you are and what startup you are, that may be applicable to you. But I think like you said, in the starting point, that's so important just to offer that mentorship in the services and that you provide. That being said, now that we're in the AI evolution and all of that, do you think, and I think even Sam Altman said this, where now entrepreneurship is going to be more common. Do you agree with that statement? What are your thoughts on with AI that it's going to produce more entrepreneurs than we ever have? Do you think that's different given the healthcare ecosystem? What are your thoughts on that piece?
I'm not sure that it's necessarily driven by AI. I think it's driven by other factors and other necessities. The rising costs of care, the complexities of care, the aging populations, the various other factors that are coming in. Care is becoming more about data management and about being able to access data. So AI obviously is a tool, but it's a tool that's, I think, being applied for multiple reasons and multiple factors. So to be honest, in addition, one of the things I do actually is I am a mentor for early stage software based companies, and we do software, hardware, and interventions. And I see a lot of startups that are AI and have AI in the name. And it's more common because in some ways it's easier. but I see a lot of Me Too's, and I see a lot of people without real solid business plans or ideas how they will make money. Oh, we're going to use AI. Well, that's not enough. Everybody's using AI now. What does AI really mean? And what is it that you're actually doing? And how will you benefit either outcomes or costs or policy? And that becomes something that a lot of early stage entrepreneurs don't know. So, is entrepreneurship more prevalent? Yes, because I think it's easier to say, we're not going to get you a job. Just figure out your own life and be entrepreneurial. So that's the message we're sending students. At the other end of it, it's a tool. You've got to have some real legitimacy as to why or how it's going to benefit people.
Yeah, no, I think that's so true because, like, with the fireside chat with Daphne, she said that too, that we have a whole bunch of tools, but what is the problem you're solving? So, like you said, that will translate into the outcomes. How does that impact the healthcare ecosystem and then ultimately your bottom line as well? And so, that being said, in the healthcare ecosystem, being it at H2I, what are some of the main areas in healthcare that you're seeing a lot of tools being produced, or what are some common areas or things that you think that are less represented that you feel that we need more innovation in entrepreneurship to kind of dabble into those areas.
I actually see the gambit. So like a spectrum of innovation. There is innovation at the point of research, at the point of analysis for various data sets and big data, being able to forecast better treatments, more personalized medicine based on people that have been treated before, and machine learning or other models of AI that will then predict your potential outcomes or endpoints in advance. And this also is in sort of married to pharmacogenetics and the whole revolutions happening in our ability to understand how our bodies and DNA and proteins work. So there is a lot more in that space of projecting. There's also a lot more in terms of, for example, the basics of developing new drugs. So, protein folding and predicting potential targets. So, increasingly, one of the startups I'm currently working with, they're looking at the 98% of our DNA that we see as garbage DNA and have never explored to see if there are any potential targets or proteins that could be coded there that might be used for cancer treatment. And so by itself, it's very hard to do because there's so much unknown. There aren't proven sites, there aren't proven targets. But with AI and models that can possibly anticipate or predict potentially good targets for pharmaceutical companies, there is this new potential. It's opening up this wild west of our genome. Um, Beyond that, I mean, I could go on. So please, stop me when you get bored. But there's also the administrative side. So, for example, scheduling. Um, uh, when you have an appointment right now, or historically, you'd have an administrator call you back if you don't show, or send you a bunch of reminders. Well, with AI agents, you can now have much more personalized contact. You can tell them that I'm late or that I need to reschedule, and they're able to do this faster and coordinate with bigger schedules and bigger data sets within either a smaller clinic or a larger hospital. And so there's potential there. Staff management, data management, being able to have continuity of care so that there's an AI agent that oversees your treatment and makes sure nothing gets lost, that your referrals aren't faxed, for example. So there is a huge potential for innovation. But at the end of the day, who's going to pay for it and who's going to benefit from it? That's what it boils down to.
No, it's incredible, and thank you to walking us through that large spectrum. Because me being on the digital health tech space is usually where my mind goes to. When you're talking about appointment reminders and all, I'm like, yep, that's my space. But when you spoke about other areas, pharmacogenomics and all of that, I think it's so important to realize that there's more to it that we don't realize. So I appreciate you walking us through it. From your perspective, because you've been in the space quite a bit, what mistake do you think entrepreneurs make and that maybe should be mindful, or just lessons learned that you've seen that you would just like to share one with the audience?
Well, I mean, I've said it multiple times, is starting out with who's going to pay. In healthcare in particular, the person who prescribes may not be the person who uses, may not be the person who procures, may not be the person that actually administers or doles something out, may not be the person that makes the arrangements, and may not be the person that ends up paying for something. So, that complexity and so many different stakeholders is really what entrepreneurs need to figure out in the beginning, not build their system or their project or their prototype and or their MVP and say, "Oh, we're going to go to market now," and then find out they don't know how they're going to make money and they don't know who wants this or how they'll be paid. So those kinds of questions, figuring out, is there a reimbursement code, or will this be paid out of pocket? How much? Who does this benefit? Those questions are so boring but so fundamental, because if you don't have them answered, you can have the best innovation in the world and nobody will know about it, nobody will use it, and nobody will pay for it.
Hey, no, that's incredible. That's a great point to wrap up here. So thank you so much for taking the time and sharing the entrepreneurial, space in H2I and the work that you do, which is so incredible. So thank you so much for coming to speak to us at the Flip conference.
Thank you for having me. It's been a great pleasure.